Hi, I'm Dr. Tipton with NorthShore Health Centers, and you're watching Ask the Expert. So today I want to talk a little bit about ovarian cancer. Ovarian cancer, which encompasses fallopian tube cancer and primary peritoneal cancer, is the most lethal gynecologic malignancy in the U.S., representing over 13,000, nearly 14,000 deaths annually. The majority are diagnosed in advanced stage, and most will develop recurrent or subsequent disease that is resistant to chemotherapy. The 5-year survival for patients who have advanced stage disease is about 20%. However, the survival for patients who come with early stage disease is actually 90%. Thus, there are strong efforts to make diagnosis at very early stages. Most symptoms of ovarian cancer are very nonspecific. Thus, it makes it a very difficult disease to diagnose. So the most common symptom includes pelvic pain or abdominal pain. Following that are several other vague symptoms, most notably abdominal bloating or distension, vaginal bleeding, urinary symptoms, or gastrointestinal symptoms. So as you can see, these are very vague symptoms, and it's difficult to pinpoint these symptoms specifically to ovarian cancer. So the lifetime risk of ovarian cancer in the general population is about 2%, so it's not a very common disorder. There are genetic links to ovarian cancer, and those genetic links represent about 5 to 15% of all ovarian cancers. The most common gene for ovarian cancer is Brca, or Brca1 and Brca2. These have a prevalence in the population of about 1 in 300 or 1 in 500 in the general population. So that means of every 500 people, about one person will potentially have the mutation for Brca. However, when it comes to a specific population, specifically Ashkenazi Jewish population, that group of patients actually has a 1 in 50 chance of having the mutation for Brca. Brca, unfortunately, is not the only genetic link to ovarian cancer. There are several others. These other genes represent about 25% of all genetic links to ovarian cancer. So who do we screen for those genetic links to ovarian cancer? Anyone who has a history of ovarian cancer obviously should be screened for genetic links to ovarian cancer. Specifically, people should be screened for the Brca gene if they have a personal or family history of breast cancer before the age of 45, if they have a personal history of breast cancer before the age of 50, along with a family member with breast cancer, or if they have breast cancer that is triple negative before the age of 60, or if they have any close relatives with any of those findings. Those are the patients that should be screened for the Brca gene. There are several lifestyle risk factors for ovarian cancer, which could include nulliparity, which is never undergoing childbirth, or infertility. Also, endometriosis could also potentially cause an increased risk of ovarian cancer. There are several things that actually protect patients from ovarian cancer. Those include having children, breastfeeding, and being on birth control medications. Those will help to lower the risk, specifically in the general population, of ovarian cancer. If you have any other questions regarding your health, please visit NorthShoreHealth.org.